In this lessons, we will look at how drugs work in the body, how drugs can be grouped based on the part of the body they are designed to treat, the effects of drugs and side effects on the body while performing treatment, the effects of interaction with other substances and of misuse, tolerance and precautions when using drugs. Safe handling of medication is one of the most important features of health and social care work and involves sourcing, storing, administration, recording, and disposing of medication. Drug forms and functions are varied, but legislation and guidance in the form of the 8 principles support professionals to work in a safe and standard way. Drugs work through the process of absorption, distribution around the body, metabolism, breakdown, and excretion, elimination. Absorption is the passing of a drug from its site of administration into the bloodstream before being carried to all the organs, including those on which the drug acts. The route of administration determines the speed, ease, and degree of absorption. Tablets and capsules. These include coated medication to reduce stomach irritation, dissolve slowly to ensure a sustained continuous release. Liquids. These includes powders dissolved in water, are useful for anyone with difficulty swallowing. Suppositories. Inserted into the rectum and pessaries inserted into the vagina. Inhaled medication. Inhaled in measured doses via an inhaler or nebulizer. Drops. For the eyes, ears and nose. Creams, lotions and ointments rubbed on the skin, transdermal patches through the skin, injections for quick absorption directly into the bloodstream. Oral, most commonly used route, uses the oral lining, mucosa, and the gastrointestinal tract, GI. It includes sublingual, under the tongue, and buccal in the cheek methods. Intravenous, IV. Injection directly into the blood. Intramuscular, IM. Injection into the muscle for slower and possibly uneven absorption. Subcutaneous, SC. Injection under the skin, providing slower absorption than IM. Transdermal, through the skin, using a patch for slow release. Per vagina, PV, via inserted pessaries. Rectal per rectum, PR. Variable absorption and may cause rectal irritation. Topical, through the skin as lotion or cream. Drug names. Generic, the official medical name for the active substance, for example, paracetamol. Brand, the manufacturer's name, for example, Panadol. Chemical, the scientific name, for example, acetaminophen. Grouping of drugs by uses or effect, for example, antihypertensives or diuretics, and by chemical similarity, for example, benzodiazepines. This is to explain how drugs can be grouped based on the part of the body they are designed to treat, and will also look at their effects and side effects while performing this treatment. Brain and nervous system, psychiatric. Sleeping drugs, used to relieve sleeplessness brought about by anxiety or depression or by physical pain or discomfort. Benzodiazepines such as temazepam and nitrazepam, zopiclone and zolpidem. Anti-anxiety, short-term relief of severe anxiety and nervousness caused by psychological problems. Benzodiazepines, beta blockers, antidepressants. 2 main types are selective serotonin reuptake inhibitors, SSRIs, and tricyclic antidepressants, TCAs. A third type, monoamine oxidase inhibitors, MAOIs, are used rarely. Effects start after 10 to 14 days, but possibly requiring 6 to 8 weeks before taking full effect. Antidepressants have been linked with suicidal thoughts and behavior, particularly with children, young people, and those with a history of suicidal behavior. Those at risk should be monitored when treatment starts or if the dose is changed. Antipsychotics, used in the treatment of psychosis and classified as typical, older drugs, or atypical, newer, and characterized by side effects known as extrapyramidal symptoms. Antimanic and anticonvulsant. Lithium carbonate or citrate is the main drug used in the treatment of bipolar affective disorder. The effect of the drug can take many weeks, so antidepressants or antipsychotics may be co-prescribed in the short term. Lithium requires regular blood testing to ensure an effective level is maintained. Heart and circulation digitalis, for example, digoxin and digitoxin, are used to treat irregular or rapid heartbeats. The side effects include nausea, vomiting, diarrhea, arrhythmias, conduction disturbances, dizziness, blurred or yellow vision, rash, eosinophilia, high white blood cell count, and less common depression. Beta blockers, for example, atenolol and propranolol, used to treat angina, irregular heartbeats and hypertension. Vasodilators, for example, lisinopril and diltiazem, are used to improve blood flow and thus the oxygen supply to areas of the body where they are needed most. Side effects include tachycardia, palpitation, cerebrovascular accident, myocardial infarction, Raynaud's syndrome, confusion, mood changes, vertigo, sleep disturbances, asthenia, and impotence. Diuretics, for example, amiloride and bendraflumethiazide, turn excess body water into urine-relieving edema, water-swollen body tissue, and improving heart action because it has a smaller volume of blood to pump as a result. Antiarrhythmics, for example, propafenone and beta blockers are used to treat irregular, faster or slower than normal heartbeats. Side effects include gastrointestinal disturbances, dry mouth, bitter taste, anorexia, jaundice, cholestasis, buildup of bile acids in the blood, hepatitis, chest pain, irregular heartbeats, hypertension, anti-angina. For example, trinitrate and diltiazem used to reduce severity and frequency of angina attacks, a chest pain that occurs when insufficient oxygen reaches the heart muscle. Antihypertensive, nifedipine and methyldopa lowers blood pressure by dilating vessels or reducing blood volume. Side effects include gastrointestinal disturbance, hypotension, edema, vasodilation, palpitation, headache, dizziness, lethargy and weakness, asthenia. Lipid or cholesterol lowering, for example, simvastatin and fluvastatin, reduces the levels of fat in the blood, helping to reduce the risk of blood clots. Blood clotting, for example, heparin, warfarin and streptokinase, used to treat problems that interfere with the clotting process of the blood. Either the blood doesn't clot or creates clots uncontrollably. Gastrointestinal tract. Many problems can occur in the gastrointestinal tract, also known as digestive or alimentary tract. It consists of the mouth, esophagus, stomach, duodenum, small intestine, large intestine, including colon and rectum, and anus. Other organs involved in the digestion of food include the salivary glands, the liver, pancreas, and gallbladder. Types of drugs to treat gastrointestinal tract problems include antacids, for example, aluminium hydroxide and simethicone, used to relieve excess stomach acids that cause indigestion. Anti-ulcer drugs, for example, lansoprazole, cimetidine, and antibiotics, used to relieve symptoms and heal peptic ulcers. Side effects include gastrointestinal disturbances including nausea, vomiting, abdominal pain, flatulence, diarrhea, constipation, and headache. Antidiarrheal drugs, for example, aluminium hydroxide, kaolin, and loperamide, provide relief from diarrhea when simple remedies are not effective, or once it is established that the diarrhea is neither toxic nor infectious. Side effects per antacids. Laxatives. For example, senna, ispagula, liquid paraffin, and lactulose are used to treat constipation. Inflammatory bowel disease. Drugs for inflammatory bowel disease in the form of Crohn's disease or ulcerative colitis. For example, steroids such as prednisolone, metronidazole, and methotrexate. These drugs cannot cure inflammatory bowel disease, but are needed to control anemia or perforation of the intestinal wall. Overdose or prolonged use can exaggerate some of the normal physiological actions of corticosteroids, leading to side effects. Rectal and anal disorders. Drugs for rectal and anal disorders in the form of hemorrhoids, piles, anal fissures, cracks in the anus, and pruritus ani, inflammation of the anus. For example, zinc oxides, corticosteroids, local anesthetics and laxatives. Breathing difficulties may arise from asthma, bronchitis, infections and emphysema, pneumoconiosis and heart conditions. Types of drugs include bronchodilators. These widen the bronchioles in the lungs, such as salbutamol and aminophylline, with the side effects including decongestants. For example, ephedrine and pseudoephedrine reduce swelling of mucous membrane and suppress the production of mucus. Side effects include local irritation, nausea and headache. After excessive use, tolerance with diminished effect, rebound congestion, cardiovascular effects are also reported. Cough treatments, used to treat dry and productive coughs, which include some opioids such as codeine. There are many varieties. Allergies. The drugs for allergic reactions attempt to treat and prevent allergic responses such as antihistamines. Minimize symptoms such as decongestants to clear a blocked nose. Infectious diseases occur when the body is invaded by microbes and it has little or no natural immunity to the microbe, or the numbers of microbes are too many for the immune system to cope with. Infections can cause generalized illness, such as influenza, or affect specific parts of the body, as in a wound infection, with some parts of the body more susceptible to infection than others. For example, respiratory tract infections. Bacterial infections can be treated with antibiotics or antibacterial drugs, either killing the infection or suppressing its production. There are many antibiotics. Some of these can treat a number of infections, others are quite specific in their actions. Some common antibiotics are amoxicillin, cephalexin, tetracycline, erythromycin, and metronidazole. The most common side effects are nausea, vomiting, diarrhea, colitis, dysphagia, and esophageal irritation. Side effects of antibacterial medication are many and varied. Viral infections can be treated with antiviral medication. Both antivirals and antibiotics can be given by mouth, through injections or topically, depending on the type and severity of the infection. Antivirals work by altering cell DNA or blocking cell enzymes so that the virus cannot multiply. Some of the most common antivirals are acyclovir, ganciclovir, zidovudine. Side effects include diarrhea, nausea, vomiting, dyspepsia, abdominal pain, constipation, flatulence, dysphagia, taste disturbance and hepatic dysfunction, and are only a few of the side effects reported. Analgesics, also known as painkillers, are grouped as either opioids such as codeine, morphine and fentanyl, or non-opioids such as aspirin, paracetamol and diclofenac. Long-term use of opioids can lead to a psychological dependence. Analgesics come in many different combinations. For example, cocodamol is a mixture of codeine and paracetamol. Diabetes mellitus, sugar diabetes of either type 1 or type 2, requires daily monitoring, often self-managed. At times, you may be required to help people monitor their blood sugar levels. It is imperative that you have received training before carrying this out, are confident to do so, and have the express permission to the service user. Insulin is administered subcutaneously, under the skin, usually alternating between injection sites to reduce scarring. A drug interaction occurs when a substance, usually another drug, affects the activity of a drug when both are administered together. This can be synergistic, increasing its effectiveness, or antagonistic, thus decreasing, or a new effect can be produced that neither produces on its own. Interactions can be drug to drug, drug to food, drug to plants. Interactions may occur out of accidental misuse or due to lack of knowledge about the active ingredients involved in the relevant substances. Caution: if a patient is taking 2 drugs and one of them increases the effect of the other, an overdose may occur. Consider the use of alcohol, nicotine, and other non-prescribed drugs when prescribing or monitoring medication. Drug-to-drug interactions may increase the risk that side effects will occur. Antagonistic effects may result in underdosage. Examples of interactions. Caffeine may increase clozapine serum concentrations and exacerbate psychotic symptoms. Dairy products reduce absorption of some antibiotics. Paracetamol taken with many other medications will increase the risk of liver damage. Excessive alcohol consumption significantly increases the risk of liver damage. Lithium taken with a muscle relaxant, e.g. benzodiazepines, will increase the effects of the muscle relaxant. Increased risk of bleeding when taking aspirin with selective serotonin reuptake inhibitors, SSRIs. Antacids, e.g. Gaviscon, taken with other medication may decrease the absorption of the drug and decrease its effectiveness. Tolerance and dependence. Drug tolerance is the need to take increasingly higher doses in order to maintain the same physical or mental effect. Tolerance occurs particularly with opioid analgesics and benzodiazepines. The prescribing GP should monitor the use of these drugs and make appropriate changes to avoid overdose and dependence. Drug dependence relates to psychological and/or physical dependence characterized by intense cravings if the drug is withdrawn. Withdrawal from physical dependence may cause sweating, shaking, abdominal pain, and convulsions. Drug dependence is a widely preferred term for addiction. Addiction is usually associated with illegal drugs or alcohol. However, millions of people are dependent on other drugs such as caffeine, tea, coffee, nicotine, cigarettes, and prescription medicines. Thanks for watching. Please like, share, and subscribe to this channel for us to bring you more educative videos such as this.